Thank you very much, Joy. Welcome everybody to Changi General Hospital, and a warm welcome to everybody for joining us at today's first inaugural CGH and Moringa Ventures Momentum for Healthcare launch day. So, I would like to begin by extending a warm welcome to Mr. Dora Lai and her team from Moringa Ventures. Thank you for partnering with us. We started first meeting, I think about 1 year ago, less than 1 year ago. Then I think it's, the relationship and the partnership has grown stronger each time we met, and it's culminated in this inaugural event this afternoon. Thank you very much again for partnering with CGH, and again for your unwavering commitment to advancing healthcare innovation in Singapore and developing an ecosystem and co-creating this. And I think we all strongly believe in the power of collaboration between deep technology and clinical practice, and this is the cornerstone of this program, and we are truly honored and delighted to have everybody in this room here with us today. So to our clinicians, innovators, investors, and ecosystem partners, thank you for making time to be here with us today, and your presence is a testament to our shared belief that innovation for healthcare is not just a possibility but a necessity. So, as we know, CGH is the only general hospital in Eastern Singapore, and we are part of the SingHealth Group, and we cover the northeast, east, and the southern part of Singapore, and our catchment essentially is the eastern region that covers up to about 750,000 in the population. So in terms of breakdown, we divide our precincts into 6 precincts, and this is the area that we cover, and this is the breakdown of the population, and this is very important as we go from beyond healthcare to health, as we look at the upstream needs of the community with regard to health. Again, this is a breakdown of the various areas I mentioned. The child and adolescent population below 20 constitutes about 18%, working adults about 56%, and the seniors is 1/4. In fact, it's rising with the silver tsunami. These are our various partners that we partner with. Again, it just shows that I think we're very committed to this whole journey, not just as a hospital, but extending the reach and the partnership into the whole community that we inhabit. These are some of the areas that we look at. Of course, as a general hospital, we cover the spectrum of medical and surgical needs, but from a clockwise manner, from 12 o'clock, we are strong in geriatrics, rehab and wound care and wound healing. We take care of the Singapore prison inmates, correctional health. We are strong in mental health, trauma care, spine medicine, aviation medicine. We support the RSAF as well as Changi Airport Group in terms of aviation medicine and altitude medicine. And also we have a strong sport exercise medicine. In fact, sport exercise medicine was set up by Dr. Ben Tan about 23 years ago in 2003. So first I'd like to talk about this valley of death. You know, when we talk about moving from innovation into translation and implementation on the ground, there are 2 valleys of death people always talk about. One is after doing the research, trying to transfer the technology to industry, there's this valley of death where, you know, it's lost, you know, in the actual transmission and translation. Then subsequently, after we develop the technology, the second valley of death is when we then translate and try to implement it on the ground to make sense and give an impact for our patients, and that's the other valley. So these sessions are important for us to avoid these valleys and to succumb these valleys so that we really make an impact. It's nice to invent new products that is sexy, interesting, but I think more importantly is to innovate to impact our patients as we journey forth and improve their health and their healthcare. So how do we de-risk the translation of our discoveries from healthcare institution perspective? First is strong leadership. We need to have strong champions and experts in the field, all of you in this room, to be able to lead and drive this forward. We need to then also have the capabilities, the skills, knowledge, and the values, both from the technology side, from the industry side, and from the clinician side, so that we understand one another and co-create and develop these capabilities to really drive innovation forward. And the organizational culture must also change. In Changi, we are evolving a system where we support our innovators and scientists to try to actually move this forward. Otherwise, it will not scale. So we are moving towards this value-driven care that the whole of Ministry of Health is doing in Singapore, where we want to have accessible value-driven care, and this is through collaboration, coordination as a whole. At CGH, innovation is not a buzzword, it's our way of life. We have a long track record for more than 10 years of innovating, and we are proud to have a diverse and growing population that is precisely holding this responsibility moving forward. Over the years, we have built a vibrant culture of innovation in CGH, one that empowers not just our doctors, but also our nurses, allied health and pharmacists and operational people. We work together interprofessionally and transprofessionally to achieve this. And it is in this spirit that has brought us here for this first event, the Momentum for Healthcare program, and it is a good inflection point as we move forward. And the challenges we face today is important. These are the key things of aging population, the silver tsunami, rising chronic disease burden, increased patient expectations, ever-present need to do more with less, where the healthcare costs we need to contain and control, and we need to act differently, act boldly, and collaborate meaningfully. And it is no longer sufficient to innovate within our own walls, but we want to collaborate across all the sectors. And true transformation happens when clinicians, technologists, entrepreneurs, and investors come together around a shared purpose. And that is what this program represents. And through this partnership with Moringa Ventures, Deep Tech, we have co-created a platform where we want to bring together deep technology and to meet important clinical needs on the ground. And we want to actually translate this through ingenuity and various technology to actually achieve this. And this is a partnership built on trust, shared values, and on a genuine desire to actually move the needle to impact our population. So today we are proud to showcase the fruits of this collaboration. This is just an initial startup. There are 5 of these startups that after that we'll share. And these are identified because they address real pressing clinical needs. And these startups have partnered with various clinicians, not just in Changi, but beyond Changi, the National Heart Centre, for example, and SNEC, to actually meet the needs across our community and then scale it up throughout Singapore and beyond. And we are committed to being more than just a test bed for innovation. We aspire to be a true partner in this innovation journey, and we want to open our doors wide and really explore creating strong networks to actually achieve this and ultimately reach our patients and impact on them and the community. To our startups, we see you and we believe you in you, and we want to journey together with you to give support that is necessary. And I hope that as you leave today, you will leave inspired, connected, and energized by what we bring together this afternoon. So a smart translation is one that is scalable, spreadable, and sustainable, one that is measurable and meaningful, achievable, relevant, and timely engaged. So this is what we want to achieve as we move forward. So on that note, again, I'm happy to declare the CGH Times Moringa Venture Momentum for Healthcare launch officially open, and let's continue to interact with one another formally and informally as we journey forth in this innovation path and odyssey. Thank you very much.